I am Prokar Dasgupta, the Professor of Surgery for King's Health Partners. King's Health Partners is an academic health sciences center involving a number of brilliant organizations. The first is King's College London, our university, and a number of leading teaching hospitals in London, such as Guy's and St. Thomas's, King's College Hospital at Denmark Hill, and South London and Maudsley. It's a real privilege to be serving as Professor of Surgery. We have had King's Health Partners Academic Surgery now for 2 years. It was established during the pandemic, and what a journey it has been. When we started, I said very simply 3 words as our tagline: be the best. The other thing that we set out to do was to improve from cradle to grave. By that I mean changing the way our medical students were taught and engaged with surgery within King's College London, right up to being able to serve senior consultants and academic surgeons do even better in life. We've had a number of successes. At the medical school level, we have engaged very well with our grand rounds, which happen once a month on the last Thursday at 5:30 for an hour. It involves a topic update followed by an international speaker as the Bulkley Barry Cooper Professor. We are extremely proud of this. This is very prestigious because the Bulkley Barry Cooper Professorship is named after Ashley Cooper and Dr. Barry, who was actually Margaret Bulkley, the first female fellow of the Royal College of Surgeons of England, a military surgeon who actually lived as a man and was subsequently, after their death, found to be a lady who had given birth to a child. Bulkley Barry performed the first successful cesarean section in the world. So this is an extremely prestigious lecture, and we have invited other surgeons from Stanford, Harvard, and so on. So this really has engaged with our students, particularly the KCL Surgical Society and the KCL Surgical and Innovation Society, which has literally started this year. Prior to the grand rounds, we have actually promoted what is called live surgery or surgery without borders. In order to do this, we have used an augmented reality platform called Proximi, again developed at Guy's and St. Thomas's by one of our plastic surgeons, Nadine Hakacharam. And this has really taken the operating room to the students without them actually being present within the operating room because of the pandemic. This, I must say, has been a major highlight. The others have been a pilot of surgical fellowships in orthopedics and trauma, in urology, my own specialty, and of course, neurosurgery, which is a major part of King's Health Partners academic surgery. The first 3 fellows have done extremely well, received their KHP postgraduate certificates, and we are hoping to expand this to all specialties within surgery and allied specialties such as anesthesia later on this year. We have done extremely well in the research excellence framework from within academic surgery. And there are 3 highlights I wanted to bring out in particular. Vascular surgery, led by Bijan Modarai, did extremely well. Breast surgery had a major return with a paper in Nature. And urology also was the only specialty with 2 surgical impact statements reported to the ref. One of them was on our 30-year journey with botulinum toxin for overactive bladders. And the second was the description of a 20-year journey of robotic surgery within King's Health Partners. We are very proud that we have done well in the ref, because this is how ultimately we would be measured within academic surgery. We've had a number of major trials that have been published. For example, Francesco Rubino, our professor of metabolic surgery, has reported in the Lancet on the long-term outcomes going right up to 10 years of the effects of bariatric surgery on diabetes. This is a game-changing international paper, and I'm really pleased that it has come out of his department. This will have major direct impact on the lives of many patients. This year, we have published for the first time the SIMULATE study, which is the first such multi-center randomized control trial across UK, Europe, China, Japan, United States, and Canada. It shows for the first time that surgical simulation makes a real difference to patient outcomes. If you compare trainees who were in the simulation arm versus those who were trained in the standard way, those in the simulation arm attained proficiency earlier than those who did not. But more importantly, there were fewer patient complications in those who were operated on by surgeons in the simulation arm. This is clearly going to have a major impact on how we train the next generation of surgeons. We have set up a major lab in St. Thomas's, right in the middle of a busy hospital opposite the UK Houses of Parliament. This is a lab called Surgical and Interventional Engineering with Professor Sebastian Orselin, the head of biomedical engineering at King's College London, and academic surgery led by me as the clinical director of this facility. We have welcomed over 20 honorary academic surgeons over a short period of time. We have every possible imaging that you can look forward to, hyperspectral, for example, next generation ultrasound, highly specialized MRI, including 7 Tesla, artificial intelligence, 3D printing, and major collaborations with industry, such as Medtronics and NVIDIA Cambridge One. We are interested in surgical data science, whereby we can capture the sounds within an operating room, track the movements of surgical instruments, and train better the next generation of surgeons. We have Mona AI Label, which can automatically segment images, such as MRI images, and design 3D models of, for example, the prostate gland and the structures surrounding it. I'm sure that this is going to improve the way we operate on our patients. We have Innersight, a startup from Surgical and Interventional Engineering, which gives the surgeon exquisite images of the kidney and the cancer within it, such that a robotic surgeon can precisely remove the cancer without causing collateral damage. A randomized controlled trial has been funded by the NIHR to see what the outcomes are of this kind of next generation technology in the next few years. I cannot tell you how excited I am about surgical and interventional engineering. It's a fantastic lab as part of one of the largest medtech hubs within Europe. And we hope that we will make a real difference to patient care because we have put the lab bang in the middle of a major teaching hospital. Come and join us. I look forward to seeing so many of you in that lab to make a real difference, a translational difference to patients over the next 5 years, not just by developing technology, but also by collaborating with industry and then taking that information into randomized controlled trials, implementation science, so that we directly impact the patients who we serve. Thank you so much.